They make a hole in the lower abdomen. They insert the two instruments. One is lightening, okay, sending picture, and another is cutting, separating lot of other tissues. So it is better to see direct visualization, that is known as scopy. Scopy means laparoscope, laparoscopy means direct visualization. I like to see through the instrument, okay, send the instrument into the abdomen and I'm moving up and down, side to side, and I see all the pictures in my monitor. Then better understanding. It is diagnostic and therapeutic. Diagnostic and therapeutic means it can give the treatment. What type of treatment? Surgical treatment. Okay, they can do surgical treatment by cutting, separating, whatever they want to do, they do. And at the same time they diagnose. Okay, is there any kinking of the fallopian tube? Is there any endometriosis? Is there any torsion of the ovary? Is there any cyst in the ovary? Ovary is displaced, hanging down. Okay, so they can diagnose. So that is caldoscope and laparoscope. Okay, so it is done and it is done. So now I will talk about the D and C. Okay, just one thing, that in laparoscope, how they do. Okay, so this is body, so the head is here. Okay, so now this is umbilicus here. They insert the instrument. Okay, these are the two instruments, two pipe actually, and lot of instruments are inside, and they can directly see with the monitor. Okay, they are taking the picture, and those pictures are in here. They can see the uterus, ovary, fallopian tubes, soft tissue, etc. They can see. That is called laparoscopy. Now I will talk about the D and C. Dilatations and curettages. D and C. Dilatations of what? Dilatations of the cervical canal. And curettage, the scratching of the endometrial tissue from the uterine cavity. Okay, so that's why its name is dilatations and curettages. During the dilatations of the cervical canal by metallic tubes from small to bigger diameter. Okay, and that tubes are not tubes, actually metallic bar, metallic rod. Okay, from thin, let me do a thinner one. Okay, a thin, because finally the instrument that will go inside the uterus to scratch the endometrium, so that is wider. Okay, in order to prevent the injury, you have to make easy dilation of the cervical canal. That's why you're gonna insert this small diameter instrument first through the external os. Okay, through the external os they will insert. They will insert first, then they will use that one, that one, that one, that one, because your final instrument looks like this. Okay, and this is a sharp edge that is looks like a blade. Okay, feel like a blade, and that wideness should be the cervical canals. Okay, this is CX canal. That is dilatations. Then curettage will occur because of the endometrial tissue. The endometrial tissue, as you know, there's a tunica basalis, and this is the red one, is the layer known as tunica functionalis. That is tunica functionalis. So this instrument will go inside and they will scratch out of the tunica functionalis. Then how I'm going to know that I reached up to the tunica basalis? Tunica basalis is firmly attached with the myometrium. And when you scratch the tissue, you got a noise or feeling. Then you have to stop. You will feel like, okay, I touch at the tunica basalis, so I have to stop. And when the tunica functionalis is coming out after scratching, it doesn't make the noise like not like that. Okay? And it can come easily. So now this is known as curettage. And this is dilatations by the metallic tube. Okay, so this, let me put the different color. Okay, so this is the device. Okay, so now question, the why the D&C is so popular? Because it has two functions, diagnostic and therapeutic. There are two reasons. What is diagnostic and what is therapeutic? Diagnostic means in order to do the diagnosis, and therapeutic means in order to give the treatment, therapy. Okay, so now why? Because what is the indication of D&C? There's a lot of indications. Lot of indications are there. Okay, somebody may come, okay, I'm not having baby. I'm having too much bleeding. Okay, and I'm having too much cramping pain and too much uneasiness. Multiple times I have period irregularly. What's going on? So there might be a big polyp or multiple small polyps. There might be endometrial hyperplasia. Endometrium is wider, diameter is wider, growing thicker, and more bleeding takes place. So doctor might think, okay, I will take the tissue out, making it clean, that is therapeutic, and also I will send it to the lab for diagnosis, that is diagnostic. Okay, most of the time they scratch out and they send the tissue into the lab. So therapeutic and diagnostic. Okay, lot of times patients the menorrhagia will be cured after scratching the endometrium, because when they scratch they cut the small polyp and they took out, and the polyp does not regrow. Okay, so that's the way they will prefer the diagnostic and therapeutic. Lot of times they have the D&C followed by hormonal pills, couple of months to get the menstrual cycle regular. Okay, so and let me tell you that sometimes there might be uterine wall, there is an endometrial wall synechia. Synechia means addition from one wall to another wall, and that interfere with the pregnancy. Okay, it can cause a lot of miscarriage, inability to get the fertilized egg implanted into the endometrial bed. It is not possible to get the baby, so they suffer from infertility due to synechia. Okay, so patient will have the appointment. Usually this type of patient has elective D&C. They make the decision, they take the appointment, and on the day of appointment they will come to the outdoor or even the doctor's private office, and they will go home right away or after 1-2 hours. And most of the times they will have a little pain, and they will be instructed, if you have further bleeding, please within 24 hours, please let us know. This is the hot number. Call this number, and they will call you to inform, are you okay, if you have any problem. Okay, so this is D and C. So now biopsy. What is biopsy means? Biopsy is used by taking off the live tissue from the body, from the organ, and they make the slide on the tissue and they examine the tissue under the microscope to see any abnormalities. Means they will check, do I know all the cell types? Oh yes, I see all those cell types, I know. They are typical cells, fantastic, no abnormalities. But if the cells are atypical, dysplastic and undifferentiated, so we call it malignancy or neoplasm. Neoplasm. Good. So it is very important to get the biopsy. And the biopsy is usually done for the endometrium and for the myometrium. Sometimes they took the tissue out from the fibroid. Okay, and sometimes they get the tissue from the endometrium and there's an endometrial polyp. They take the tissue out, they cut that polyp, they send it to the lab for biopsy purposes to get the diagnosis. And the biopsy is mainly done for neoplasm, to see it is benign or malignant. Benign or malignant. Okay? So then when the result comes, according to the result, so they will give the treatment. Okay? And the management profile, they will go along with the result. Okay, and keep that in mind. If it is a benign, they will prefer, unless it is bothering you, so we'll keep it as it is. Let's say we'll do the follow-up. If it is a malignancy, they will say, no matter what, we need to take the organ out. Now question, if the girl is not pregnant yet, not mother yet, what gonna do? So there is no way. Malignant is malignant, locally malignant. So at least you can do locally dissection out of the mass. It depends on the type. Stages depend on the stages. Which stage is it? Stage 1, stage 0, stage 1. Most of the time these stages can be 100% recovery. Surgical out of the tumor followed by radiation may be good. Patient may have pregnancy. But if it is delayed and stage 3, stage 4, no. They will take the organ out. There is another treatment they give called arterial embolization. Arterial embolization for the benign and malignant both, they make embolization on the feeding artery. And the feeding artery will be occluded and the tumor may need to the compromise with the oxygen and nutrient supply. If not, so then if not means if they don't get the food and oxygen, they will die. They will compromise with the supply. But the problem is in malignancy, there is always neovascularization, and because of the neovascularizations, you block one artery, but there are a lot of collateral arterial supply and venous drainage. They will develop and cancer may not be stopped. Cancer cells may not compromise. Okay, so there are a lot of idea they have. Okay, so accordingly they will do it. Now, hysterosalpingogram. What is hystero? Hystero means the uterus. Salping means the fallopian tube. hysterosalpingography. Understand that it is the visualization of the inner tissues, inner cavities of the uterus and the fallopian tube by a contrast media that is injected through the cervical canal into the uterine cavity. Okay, understand that. That is hysterosalpingography. Okay, so this is uterine cavity and this is the endometrial cells. And endometrium have its cavity, we call it endometrial cavity or uterine cavity. Okay, that's fine. Okay, so now I like to see this uterine cavity. Okay, make the uterine cavity nice, uterine cavity, fine. And I like to see along with this the fallopian tube. I like to see the fallopian tube's cavity along with the uterine cavity. Question, why? Why I need to see this cavity is either intact or obstructed? Okay, so we know this is vagina. Okay, write down. Okay. This is vagina, this is CX canal, this is external os, internal os, or at this level we call it isthmus. This is uterine cavity, and this is fallopian tube, fallopian tube. Okay, so now I like to see this cavity and this tube's cavity. Why? I like to see that is it patent or obstructed. Why? Because the patient says I am suffering from infertility. And I know the causes of infertility may include the obstruction or blockage or synechia or many tumor obstructing the uterine cavity, or it could be the fallopian tube kinking, torsion, tortuous, obstructed due to the PID, or absence of the fallopian tube, or obstructed, occluded of the fallopian tube. It is not patent from uterus to the pelvic end. It is not patent, it is obstructed. How do I know that? Okay, they said, okay, don't worry. Through the tube, like a catheter, okay, insert the tube through the cervical canal, insert the contrast mediated dye. That is, insert the dye through this tube into the cervical canal then from the cervical canal through the internal os into the uterine cavity. Okay, so now then inject the dye or contrast agent that will cover the uterine cavity. Then from the uterine cavity it will go to the fallopian tube if there is no obstruction. Okay, I am making it prominent so that you can see if there is no obstruction. That contrast agent should go all through the fallopian tube, and even it goes into the pelvic cavity. Look at here. It will come out through the pelvic cavity. It will come onto the pelvic cavity through the fallopian tube end. Okay, so this is contrast agent. It's a non-harmful contrast agent. Okay, and it is injected through the tube. And you take the picture. You take the X-ray. And you see the outline of the dye. Even the dye in the pelvic cavity, it confirms that both side fallopian tube is patent, intact, and the uterine cavity is intact. Okay, so this is known as hysterosalpingography. I hope you understood. And it is normally it is practiced if somebody is having infertility